Hello everyone. Adens was asking me about the best aligner course, and they mentioning three aligner companies. Like, which company should I take my courses with? And I believe they are answering the wrong question. I told them, I think you're answering the wrong question, and let me explain to you why they're asking the wrong questions. So first, for credibility, my name is Khaled. I have been a dentist for 20 years, and I run my own dental practice, Lakeside Dental Spa in Harvey Bay in Queensland. I took from 1 chair to 10 chairs, from 3 staff members to close to 40 staff members, and over the course of 15 years, and you can check my details below for credibility. And I've also been offering aligners in my practice for close to maybe 1 year before I even opened a practice, so around 16 years in my practice, and maybe involved with orthodontics for the whole 20 years, even as an undergrad, where I used to work with an orthodontist in Egypt as an assistant as well in my final years. So why you're asking the wrong question is, I'll give you an example or analogy first. Imagine you want to drive from Brisbane to Sydney. Now, you asking me what is the best car to take me from Brisbane to Sydney. I would say you're asking the wrong question. You need to ask what is the best GPS that will take you from Brisbane to Sydney, because the GPS is the most important. I can give you the best car in the world, but if your GPS is not set up properly, you'll end up in Perth, or you'll end up going to Sydney through a lot of side roads and slower, through a lot of traffic. It's not going to be a pleasant experience for you and your passengers. So aligners systems or aligner companies are like that cars. It doesn't matter what car you're using. Of course, some would be better than others, some would be more common than others. But what's more important is the GPS, which is the orthodontic knowledge. The orthodontic knowledge will get you to decide, I want to take this case from X to Y, and I want to do it in the minimal amount of time, the maximum patient comfort, the maximum patient satisfaction, and the minimal least complication. And in orthodontics, if you have the wrong plan, the wrong GPS, you set on the wrong destination, your case will go from a class 2 to a massive open bite, from a class 3 to a worse class 3, from crowding to perio and gum recession and bone loss, or over expanded or proclined anterior teeth with no lips. Like, your plan can go in a wrong direction, and you keep rectifying and spending a lot of time and wasting a lot of time and effort trying to fix the case, and end up with a patient not satisfied, or you might end up reaching the destination with a lot of problems. So my question to you, you should ask, what is the best orthodontic course? If you're not an orthodontist, if you're not planning to be an orthodontist, of course, which I highly recommend, is to become an orthodontist. But let's say you want to stay as a general dentist like myself and you want to practice orthodontics. What is the best orthodontic course that will equip you as a general dentist to deliver satisfactory orthodontic outcome using aligners and probably braces if you need to? That's a better question to ask. Then later on, once you have experience, you can ask what is the best aligner company to use and why. It comes to customer service, the aligner materials, their shipping time, and how many aligners they give you per case and so on. But you should ask what is the best orthodontic course. And again, your aim is not to become an orthodontist, because you probably have much better skills and much better experience. Your aim is to deliver good orthodontic cases for majority of your patients. Some patients you're still going to refer to an orthodontist. However, I myself took courses with Dr. Derek Mahoney back in 2007, and that's covered mainly braces, of course, back then. But then I did a lot of training with Invisalign through different training with Dr. Tony Weir, a lot of different speakers from the US. I even went to Hong Kong, I went to Singapore. I did numerous, thousands, a lot of hours in aligner training, because the biomechanics in aligners is very different than biomechanics in fixed braces. The planning is similar, the end of mind is similar, the orthodontic knowledge is similar, but the workflow and the staging of the movement is a little bit different biomechanically. You need to understand that. So nowadays we're lucky, because we have a lot of courses that were not available 20 years ago, where they will teach you orthodontics, but also from the aligner biomechanic point of view. Bear in mind, if your aligner case is not going well and you need to put braces on, you might have to refer if you don't have the skill to manage braces, of course. You'll have to refer, and you need to specify that in your consent form, make it very clear. how much you're going to refund the patient, how much they're going to spend on orthodontist to get their braces done. The current courses I would recommend, Dr. Eric Mahoney, I still believe he has runs really amazing orthodontic courses, and he has aligners modules in them, of course. Dr. Jeff Hall recently started into aligners in the last 5 or 6 years or so, so he runs some really good aligner course as well. Dr. Vandana in Sydney, boss aligner training as well, great orthodontic knowledge and aligners, or more aligner biomechanically driven. Master Coip in Spain, they run an online training and can go to Spain as well and attend their courses. Their biomechanics in providing aligners is crazy good, really interesting as well. So those are probably one of the cases. Of course, there's a lot of other courses, and a lot of mentorship is important, having a good experienced aligner mentors that help you with planning as well. But that would be my starting point, is to understand orthodontics and then learn aligners, not the opposite way around. Because the aligner company are just gonna teach you how, again, similar to a car situation, it's like a car dealership, they will teach you how to drive this car, how to get the first gear on, how to open the window and so on, but they're not gonna teach you how to use your GPS or how to plan your GPS. So aligner company will teach you how to put attachments, how to deliver aligners, how to use software, but they're not gonna teach you how to diagnose and plan accurately your diagnostic problems. If you find this information helpful, make sure you like it and share it with your friends and colleagues. If you want to hear more about my videos, please subscribe to my channel and you'll be notified when more videos are released. Thank you so much for listening to me. It means a lot to me.